Go ahead. Then there's the vacuum device. Various FDA-approved devices. I always stipulate it doesn't really matter to me what devices patients would purchase or look into, but as long as it's a good product and it's certified FDA approved. It's not going to hurt you. They have pressure release valves and so forth. Luke did mention, he's from Windsor, and he did bring a little clip. When I did a talk for our group last year, we did a clip on my rep that I brought with me to Windsor on the vacuum device that we actually promoted Henry Ford, because I find it's probably one of the best devices on the market. So maybe he'll show that clip with you later today, but it'll give you an example of how the actual pump functions. But we use it for stretching. Go ahead, I'll tell the patients, start incorporating pump therapy into your routine. And we do tell the patients, you do have to wait about 4 weeks after surgery, or radiation patients can start it right away. Then you start using it slowly, and you need to know that it's going to be something a little uncomfortable initially. Same concept as if a woman who is nursing and uses a breast pump. Breast pumps, for the first time, I don't know if any women have ever used a breast pump. I have personally, and they hurt. They're very sensitive. So it takes a good couple of weeks to get used to it, because breast tissue, penis tissue, very sensitive parts. And putting something on it and sucking the heck out of it is not something that's that tolerable. So it takes some customizing to get used to it, yes.
Did you say that part of your post-op procedure was to do injections to make sure that things are working?
Yes.
So it's not new at this stage. If your patients have already had the injection?
Right. We actually just changed our injection protocol. Immediately after I take the catheter out, I was giving the patient their first injection on the table. However, in the last month, we started giving them in the operating room. So when the patient's asleep, they'll give the patient a potent formula to get an erection while they're asleep. Because what we're trying to find out is, with blood flow in the penis at that time, during the resection of the prostate, we're trying to see if by putting extra oxygen within those tissues is going to help minimize what's called neuropraxia, which is the side effect of the surgery in the nerves that have been traumatized. After they get that first injection, then the next day after surgery, when they're just before they're discharged from the hospital, we give them another one. And then they get their third one. I give them one to take home at that point to give their own injection at home on post-op day number 3 or 4, if they're not too swollen. You know, sometimes you get too swelling, the swelling, the bruising. And at that point, they've already watched the DVD before they've had their surgery. So I'm trying to get everybody to watch this DVD so they know what's coming. And then when I see them take the catheter out, they're probably getting their 3rd or 4th injection at that point. So we're slowly moving the dose upwards until we know what's effective for the patient. Okay.
Is that DVD available? Would it be available to us?
It's password protected, and I did that just to protect it for Henry Ford. So it's available on our website through Batacuti Foundation, but we did put a password on it. I haven't given that much thought, and I don't know what that would do personally to our, I don't want to do anything, it is Henry Ford property, so I can't say that I could give it to you.
Negotiate that with Jerry.
I gotta think about this a little bit more and how, you know, but we'll see. I mean, we'll see. So anyway, we tell the patients to use the vacuum pump for penile stretching, and then once they get graduated into it and they get accustomed to it, then we have them research on their bodies the pumps, rings that it comes with, and using the rings, the bands, to help maintain the erection. Oftentimes, men can get the erection, they take the pump off, and it goes down. So if they want to use it for sexual activity, we tell them to practice, so putting the rings on to help maintain it. And before I go into the injections again, combination therapy is very, very important. In the literature, if you were to Google penile rehabilitation after a radical prostatectomy, you will see many different research articles that come up. And one of the earliest research that's been done was from European urologists. The name is escaping me, but anyway, they did the injections. And he was one of the urologists that did the injections and found out that men's sexual function or potency down the road had improved by putting men on injections earlier rather than waiting. Then there's research that's out on the vacuum pump and the pills in combination with each other. and how it's more effective than just using a pump alone. So if you were to Google this, you would see a whole list of different names that come up, notable names that have done research on penile rehab. What we don't know is what's the perfect scenario and what's the perfect protocol to put patients on. We don't know if using a vacuum pump 4 days a week is just as good as daily use, or our penile injections may be superior to a vacuum pump. But I think most of the research is gearing towards vacuum pump for potency recovery down the road. Okay. The reason we went right to injections is because we know that they're the most successful usually in aiding sexual intercourse. Because they work quickly, 5 to 15 minutes, the injections work, and it's mostly the mental block that men have to get past before they do that. Yes?
So, for radical prostatectomy, you have that, and then I was told it could be up to 2 years before you would have, might be successful with an erection that could be meaningful. Versus what you're talking about, what is it, 6 months later, 3 months later, a year later? No.
Correct. You're thinking, your question was, would putting a patient on this maybe speed up the amount of recovery? We don't quite know yet. But we are looking at our data, but we can tell patients that their satisfaction levels go quite high. Because now we're not letting the patient just stew over all this and waiting for healing. I have seen relationships come apart in this field because of these issues. And, you know, not that sexual function was the reason, it was probably other baseline problems within a relationship, but our job is to help that couple right off the bat, fast, quickly, rather than waiting a year to 2 years. Because, you know, it's a long time, right? So the penile injections, it's usually very easy to learn and administer independently with proper training. Technique is everything. And usually if I put a needle in a guy's hand, he's shaking, and he's like, oh boy, you know, and he's sweating. So most often what I'll do is I'll just do the first one for him. I'll say, okay, try to just take some deep breaths, watch what I'm doing, and I just pull the penis out, push back the foreskin, and I says, it's like a dart. Just dart that in. And what I'm going to do, if we could have a needle passed around on this side, and I'll have a needle passed around on that side. This is the needle. So you can see that this is it's a diabetic needle. Be careful when, take the orange cap off. If you're going to recap it, you can poke your finger, so be careful, okay? But it's a very soft needle. It's an insulin needle, and it's a 31 gauge. They're measured in units, so they're not cc's. They're measured in units. Take it off. Take a look at the needle. Yes.
I just saw it when he took that.
Oh, you did? Oh, okay. I was going to say, here's a guy that's really scared. He's not even taking the thing off to look at it. He's just passing it right on along. Okay, so this is the size of the needle. I tell patients that with technique, it's not huge. It's huge after it takes effect. Just keep that in your mind. It takes practice, and I'll tell guys when they're going on this therapy to take like a little grape. Take a piece of fruit that has similar thin skin, puncture it with some water, and practice that way before you put it in your own tissues. And be careful with the urologist. I always tell Dr. Menon he's too rough. I says, get away from him. You're not touching that penis. You don't know how to do this right. So that's when he throws his hands up and says, okay, you know what you're doing.
From what you were describing, it sounded to me like the injection was going into the glands of the penis.
I'm going to show the landmark in just a minute, yeah. I'll show you exactly the landmark where it goes. So it's effective within 5 to 15 minutes, and they're BD, if you guys want to write this down, they're BD ultra-fine needles. And it's on the bottom screen here, 5/8 of an inch. Don't let your urologist give you these, you know, harpoons. Okay, now, they do make some medications for injections that are purchased right through regular pharmacies like Shoppers Drug Mart and that, called Caverject or Edex. Those needles are going to be longer, okay? And that's fine if you're used to it, that's absolutely fine. But the needle that I'm passing around is something that would go along with what's called a compound. So a compound pharmacy manufactures the medications in a little glass vial. So that's how we could get away with the small needles. You just drop what you want, put it in the fridge, and it's good for 3 months or so, and depending on what kind of mix it is.